Hi there, I'm Pamela Ho, he's Stanley Leong, and you're tuned to the Living Room on 938 Live. Now, what do Elizabeth Taylor, Sarah Michelle Gellar, Isabella Rossellini, and Vanessa Williams have in common? Well, other than the fact that they are stunningly beautiful celebrities, well, these women suffer from scoliosis, a condition that affects the curvature of the spine. Well, according to a survey carried out in Singapore by a team of spine surgeons in 2008, it was found that 1 in 10 Singaporeans over 40 suffer from lumbar scoliosis. And the condition is in fact 1.6 times more prevalent in women and twice as often in Chinese and Malays than in Indians.
Well, worldwide, scoliosis strikes about 2 to 3% of all adolescents, and the condition becomes noticeably, usual, especially between the ages of 10 and 15. It afflicts more girls than boys, with an inequality of 3.6 to 1. But what are the symptoms of scoliosis? What causes it? Is it genetic? How can it be treated? Well, I'm sure you've got your own fair share of questions as well. We hope to tackle them all in the living room today. Well, other than painful surgical procedures that involve inserting rods, are there non-surgical methods of treatments that work just as effectively? Well, according to our guest in the living room today, there are. And as author of the book, Health in Your Hands, Your Plan for Natural Scoliosis and Treatment, chiropractor and nutritionist Dr. Kevin Lau proposes an alternative route to the prevention and treatment of scoliosis that is completely natural and safe.
That's right, that's good news, I think. And Dr. Lau is a graduate and doctor of chiropractic from the RMIT University in Melbourne. And he also holds a master's degree in holistic nutrition from Clayton College of Natural Health from the US. And he's a member of the Chiropractic Association of Australia and the first in Singapore, in fact, to provide a non-surgical chiropractic treatment program for scoliosis in Singapore back in 2005. Well, with painstaking research and years of practicing natural and preventive medicine, well, Dr. Lau separates fact from fiction in his book and provides a unique approach to healthcare which encompasses body, mind and spirit. And he is one of the most experienced in non-surgical scoliosis correction in Singapore, treating hundreds of scoliosis patients to date. And we're indeed glad to have him as our guest in the living room couch today. A very warm welcome to you, Dr. Lau.
Thank you for having me.
Yeah. First of all, Dr. Lau, tell us a little bit about scoliosis. Exactly what is it and what is it not?
Okay. Scoliosis is actually a deformity of the spine. Usually it entails a rotation as well as a sideward bending. And when it's not scoliosis, most spines actually have a bit of a curvature. When it's over 10 degrees or a certain degree, then it's considered scoliosis.
Mm. Okay, and what would be some of the most common misconceptions people have about scoliosis?
I think the most common misconception that most people have is that there is nothing that you can do to affect the quality of your health of your spine, and that is the main reason why I've written this book.
Mm.
Now, some people would think that scoliosis would be more all about posture and the way you look, the way you stand, the way you walk. But how does it, or how can it really affect health in general?
Scoliosis actually has a far-reaching sort of effect in the sense that when people start sitting for long periods or start putting more pressure in through their back, it can lead to more aches and pains as you get older.
Right. So let's say if I have I have 2 little boys, and if they were to carry really heavy bags, and over many years, would that cause scoliosis?
Unfortunately, scoliosis isn't just purely a physical condition, and majority of the times most people think it's poor posture or carrying heavy bags. From what I've known is that scoliosis is a lot more a deeper issue in the sense that it's biochemical, it's neurological, it's hormonal. It's a multifactorial sort of disorder. So it isn't as simple as just poor posture or carrying heavy bags.
Carrying heavy bags, but I think one outcome would be just being short like me.
Oh, me? Oh, dear.
But something that Dr. Lau did say, that he said was that it's going to be about 10% deviation from what's supposed to be good posture or good alignment. Alignment, yes, yeah, that would be the word then. How do you measure that 10%?
This is actually measured on X-ray. So on X-rays we can actually measure the definitive degree of the curve through a method called Cobb's angle.
Cobb's angle.
Yes.
Tell us a little bit about Cobb's angle.
Okay. Cobb's angle is actually a way of ruling out on an X-ray the spine and also measuring the angle of a curvature in a spine. It's actually a little hard to explain unless it's visual.
So is this x-ray done with the patient lying down or standing up straight?
Normally it's done standing up, and they normally take a full spine x-ray.
And actually, who does scoliosis affect? I mean, are there a particular group of people that are more susceptible to it?
Definitely adolescents. The most common type of scoliosis is idiopathic, and idiopathic just means unknown cause. Most of these are between the ages of 10 to 15, and like you said before, they're mostly women.
Wow. So, I mean, if let's say, is it a hereditary sort of a thing if your parents have it? You know?
Definitely. There's been clues that genetics is involved. If your mother or a sibling or a family member has it, there's about a 25 to 35% increase in chance of getting a scoliosis.
Now, when talking about scoliosis, would the symptoms be, evidence to the eye, to the layperson's, looking at someone's posture? Oh, that person has a problem, that person could have scoliosis. Can we just tell straight from visual, sight, or must it be actually medically diagnosed?
Oh, definitely through sight you can see. There are some scoliosis where it's easily concealed, especially behind clothes, but there is a test out there that most schools here in Singapore actually do with kids. This test is called an Adams test. And what they do with these kids is they get them to bend forward. And when they bend forward, if they've got a curvature, the spine actually rotates and the rib kind of rotates along with it, leading to a hump that's visible.
So that was what the purpose was for then.
Yes.
I still remember bending forward. It's cool, but we never knew
for,
what they were looking at.
But, I mean, doing that test, though, are there kids that actually fall through the cracks? I mean, in terms of identifying this condition in school checkups?
Okay, luckily there isn't. They're actually quite good in terms of making sure that they're going through everyone quite thoroughly in Singapore.
Okay, that probably means I don't have scoliosis then.
You want to bend forward? Probably not now, but well, of course, we hope that you're not encountering all these difficulties as well concerning posture. We're talking about scoliosis today. What is it, what it isn't, and also about treatment options available for you. And that's something that we'll really want to get a better idea of as well.
Yeah, before we actually look at the non-surgery sorts of treatment, I mean, Dr. Lau, what are the traditional methods of treating scoliosis that are currently available? And, how would this, differ from methods that are described in your book? That would be the second part of the question.
Okay.
Yeah.
Conventionally, most scoliosis are going through in 3 different stages. If it's a mild curve that's under 20 degrees, they normally recommend a wait-and-see approach, where they just observe a kid over 6 months or a year just to see whether or not it's progressing. If it's a moderate sort of curve that's between 25 to about 40 degrees, they usually recommend some sort of bracing to hopefully prevent it from getting worse. A severe curve that's over 40 degrees, they normally recommend spinal surgery. And spinal surgery involves putting in rods or some form of fusion that helps to stop and arrest the curvature from continuing.
Right, that is really invasive then.
It is, and unfortunately I think a lot of people think that even in the earlier stages there's nothing that they can do. And that is the main reason why I've created the book. The book goes through a lot of dietary means as well as exercise and also lifestyle changes that will help to maintain the health of the spine and even hopefully make it healthier.
You mentioned bracing, but is that more just to prevent it from getting worse, or can that actually reverse the effect of scoliosis?
Bracing is actually just to prevent the progression.
All right, to arrest it where it's at and stop it from getting worse.
Yes. But even bracing itself, it's quite controversial in the sense that there hasn't been a lot of evidence
and studies
yes,
put into it.
Correct.
It's funny, but now that you mention it, I have a friend who just mentioned to me that she has a crooked spine. Would that mean scoliosis? And she says that she was found to have a crooked spine, but I don't see her using bracing or anything. But sometimes she gets pain when she does active sort of work at the bottom of her tailbone area.
Yes.
Would that be common problems for people who are not treated, so to say, but who live with scoliosis?
Yes, definitely. I think bracing is mainly just done during the adolescent phase when there's a lot of growth spurts. So after that, when they've gone through most of their growing, they don't actually recommend bracing, and then they are allowed to just do whatever they want to do.
Would that be dangerous though for them if they're not treated, so to say?
Scoliosis does still progress even as they get older, and it tends to progress 1 or 2 degrees per year.
Oh dear. I better go tell my friend that.
Yes, tell your friend, Pam.
That's
But
right.
also, of course, pointers that we can put in place ourselves in our very own lives, just so we're not bending the way we shouldn't be, and of course, keeping not ramrod straight. No one's totally having a perfectly straight spine. In fact, I believe the curves, a little bit of a convex in on the top half of our spine, a little bit of a concave at the lower back,
Yes,
and all.
definitely.
But we'll find out more about the spine and its makeup and all in the next part of our program. In the living room today, we're chatting with Dr. Kevin Lau, who is a chiropractor and nutritionist, and he practices at Orchard Clinic, and we'll give you more details about that clinic also later on our program. Stay tuned to find out more about scoliosis and all the treatment options available, especially those that are non-surgical in nature. This is The Living Room on 938 Live.
Experts take the couch. The Living Room on 938 Live.
Well, thank you for staying with us, Stanley Leong and myself, Pamela Ho, and you're tuned to the Living Room on 938 Live. Well, we continue the conversation with our expert on the couch today, and he is Dr. Kevin Lau, and he's a chiropractor as well as a nutritionist practicing at Orchard Clinic. And we are finding out more about the treatment of scoliosis, which is a condition that affects the curvature of the spine. But more so, we are exploring a non-surgical method of treatment, and this is part of a treatment that is mentioned in his book called Health in Your Hands, Your Plan for Natural Scoliosis Prevention and Treatment. And of course, we'll be finding out a little bit more about that book in just a while. But we do have some more questions for Dr. Lau with regards to the anatomy of the spine.
That's right. Is your spine an S or a C? Well, that's something I just picked up during our news break. That, you know, the natural posture or alignment of the spine, if you like, takes on either the slight form of an S, the letter S, or C. I didn't know about the C until now.
Yeah, it sounds like a very hunched sort of a posture, doesn't it? A C.
Doesn't sound good then. Time now to find out more from Dr. Lau about the anatomy of the spine. Tell us more about the variations there. What's
Okay,
natural?
when it comes to a normal spine, when you're looking from the behind, the spine should look quite straight. There is a minor amount of deviation between everyone, but for someone that's scoliosis, it can come in 2 different types of variations. It can be in an S curve or a C curve. I've actually seen curves that are 3 curves or 3 S's or 4 S's, so within those deviations there are minor changes.
And how would you know that those curves are normal or it's not normal? I mean, how would you, kind of decide?
Well, definitively, I think most of the time it's just through x-rays and getting that Cobb angle that we discussed about before.
Right, and talking about forms of treatment, I mean, for most chiropractor, we were just discussing earlier, other than bracing, the more serious cases, you actually have to go for a spinal surgery. But, as a chiropractor and a nutritionist, I mean, how do you tackle scoliosis that is different, let's say, from the other Western sorts of medical treatments?
Okay, well, conventional sort of medicine tends to tackle on disease in philosophy through intervention. Whereas as a chiropractor and a nutritionist, I'll primarily work on the health of a person and making sure that the spine is growing properly. So it's kind of a roundabout way to try to improve the quality of health of that spine.
And when we're talking about the spine, of course, we're talking about bones as well. Does protein figure largely in the way the sort of advice and recommendations you would advise patients, protein intake and all?
I think protein is especially an important aspect, especially when it comes to adolescents or young girls going through a lot of menses and they're going through a lot of changes in their body. They actually need a lot of calcium and iron and other things that are helpful to support the growth of their spine. Which is also delved into the book in more detail.
Right. But looking at, taking a step back, I mean, how did you first even get inspired to research on scoliosis and the natural sort of methods of treating it?
Well, through research, I've realized that this concept of natural sort of treatments isn't a new concept at all. Throughout the world, in America, in Germany, in Israel, there have been programs and methods out there that has been documented to help people with scoliosis. I've discovered that a lot of people in Singapore was feeling quite hopeless or disempowered whenever they were diagnosed as having scoliosis, or waiting for surgery to eventually come. So they didn't really have a method or any sort of direction. So the book came about as a way to just enlighten people and also give the power back to people that there is a bit of a hope out there. Through my research, I've actually gone through and I've discovered through the different methods and taken bits and pieces, and I've kind of compiled it into this book. And this is the same sort of method that I use on a regular basis in my practice.
And do you perhaps draw also examples from the different clients that you have also treated through the many years that you've been practicing,
Yes.
and also putting them into the book?
Yes, there's heaps of testimonials and also case studies, so then people can understand other people who have gone through the same sort of condition. There are young kids that have gone through this sort of program thinking that they had to do surgery, and then they could avoid it at the end of the program. There are also 40-year-old ladies that certainly surgery for them isn't an option, so they want to do something about it before it gets to the stage where it starts affecting their quality of life.
And you're definitely one of the most experienced in non-surgical scoliosis correction in Singapore. I mean, you have seen hundreds of patients, and I think one of our main local newspapers have also identified you as a leading practitioner, given you an award for that as well. Now tell us a little bit about what happens when a patient comes to you, comes to the clinic to see you. What do you actually put your patient through? What is the procedure like?
Well, most patients go through a series of taking x-rays initially, so then we can see what degree they are beforehand. And then over a course of a few months, 3 to 6 months, depending on how severe the curve is, they go through a series of exercises, medical equipment, as well as chiropractic treatments with me. Nutritional advice is also given out each session, so it tends to be quite holistic in its approach.
How many sessions would one be required to attend?
Oh, depending on the severity of the curve, if it's a moderate curve, we're looking at about 6 months, where they come in twice a week.
Okay. Well, in the living room today, we're hearing from Dr. Kevin Lau, who is chiropractor and a nutritionist and practicing at Orchard Clinic. The clinic is located at Rolex Centre on Orchard Road, downtown. In fact, if you'd like to find out more about scoliosis as well, they do have a website, and a very convenient one to remember as well.
Yeah, that's right. Well, the website is www.scoliosis.com.sg. Scoliosis.com.sg, of course, spelled SCOLIOSIS.
That's right. And you know what, Pam and I, both of us, of course, being Chinese, we and the Malays, Chinese and Malays apparently are twice the Indians more susceptible to actually becoming...
Yeah, and women more than men. So
Yes. Being affected by scoliosis. So Pam, you're two up from me then. No, you're one up from me, but we're two up. Anyhow.
Yeah, that's right.
I'm just wondering why. Is it the diet? Is it... I don't know.
Yeah,
Is there any reason for this as to why certain races are more susceptible to scoliosis?
Races, yeah.
Certainly diet, I think, is a big part when it comes to scoliosis. That's quite controversial. Within the book, I do delve in much more in detail in terms of why I think diet is a big part of scoliosis.
Yeah, and in your book, you describe the resilient health of primitive cultures living off a traditional diet. Now, but how are traditional diets of primitive cultures relevant to today's modern society? Because we are definitely bombarded with lots of processed foods and fast foods and stuff like that.
Oh, definitely, and I think most of the basis of my sort of research was actually through a dentist in New York who in 1920s went around the world and studied primitive cultures and discovered that they were pretty much resilient from most degenerative sort of diseases. What he found was healthy, well-formed, structured people with good mental sort of capacity and emotions. And then what he found was one generation after they were introduced with a more modern sort of Western diet with processed food and fast food, they started getting cavities and crooked teeth and deformities, and suffered from a lot more of the degeneration that we tend to see on this in modern life.
Well, that's scary. A lot of illnesses come because of the foods. We don't even realize it, actually, when we think about that. Yeah, and of course we are talking with Dr. Kevin Lau, and he is a chiropractor as well as a nutritionist, which is quite a unique combination because he's able to give us a very unique perspective on treating scoliosis, which is a natural sort of treatment that doesn't involve inserting rods as well as, a surgery. Now, when we talk about, when this the people who come and see you, I mean, I would really love to hear some real-life stories of patients who have come to see you, and because of certain diets that you've prescribed to them, that you have actually seen, them improve because of that.
Yes, definitely. In the first chapter of the book, it actually highlights a patient of mine who's actually been with me for about 5 years. When she first came to see me, it was primarily just a back or spinal issue, and then over the course of just changing her diet and also improving her lifestyle habits, we're actually able to reduce most of her medications. She went down from 12 different types of medications, from heart, high blood pressure, diabetes to cholesterol issues, and it all reduced over a period of a couple of years. And even to this day, she's still reporting back to me and telling me that most of her medications is still reducing.
What about the curvature of the spine then? Has that also improved?
Yes, that improved already. But that was the initial stage.
Right.
So like I highlighted before, my main emphasis is just really focusing on improving the health of the person and then letting the body heal itself.
Would it mean then a whole change in the sort of foods that one is supposed to be taking, in terms of even spending more money, perhaps buying, I don't know, organic food or stuff, more expensive food stuff?
Not necessarily. I think, especially here in Singapore, organic foods tend to be very restrictive. It's not easily accessible. I think if people just do the simple switch from processed foods to more whole-based foods, foods that actually spoil when you keep it out for a bit of time, those tend to be a lot more nutritious.
I never thought about that. Foods that spoil, the more, the quicker they spoil, the more nutritious they are.
Oh, definitely.
Is that so?
I mean, most foods these days that are processed, they're processed primarily just to improve shelf life.
Yeah.
And to prevent wastage. So through these processing, unfortunately, due to modernization, they do tend to lose a lot of nutrients.
Right. So traditional whole foods would be foods that kind of look like they do in real life. Somebody told me that, like a chicken looks like a chicken, but, a fishball you don't see a fishball in nature.
Right.
So it's processed. I don't know how to define it other than that.
I don't know about fish balls. We're putting a pause on this, and we will fish for more answers with our guest today in the living room, Dr. Kevin Lau, who is a chiropractor and nutritionist from Orchard Clinic. The living room will continue in just a bit. Stay tuned.
Relevant, real, reliable. The living room on 938 Live.
Well, non-surgical treatment of scoliosis, that is what we are talking about today. And it is a condition that inflicts, in fact, more women than it does men. And in fact, it is one of the conditions that famous celebrities like Elizabeth Taylor, Sarah Michelle Gellar, as well as Vanessa Williams, I mean, all of them suffer from this condition. But, most of the traditional treatments have been a little bit scary. For example, like inserting rods in your spine.
Ouch.
But we are talking today about more natural forms of treatment, and this is outlined in a book called Health in Your Hands, Your Plan for Natural Scoliosis Prevention and Treatment. And our guest today is the author of that book, and he is also a chiropractor and a nutritionist by training. His name is Dr. Kevin Lau, and we have him on our couch today. And so far we've been chatting about finding out more about scoliosis as a condition and finding out about the traditional forms of treatment. We're currently going into, the third part of our conversation, and we're finding out more specifically about the diet and how that the role that plays in helping to treat this particular condition. And Kevin, in your book, you mentioned a method of customizing a diet called the metabolic typing diet. Now, what exactly is this metabolic type that we are referring to?
Well, metabolic typing understands that everyone is different and everyone's metabolic needs is different as well. A good example of this is probably looking back onto primitive cultures and looking at Eskimos. And Eskimos were primarily eating a diet of 90% fat and meat with very little vegetables. Yet within their own language, they didn't even have a definition for heart disease or cancer. Then if we go to India or South India, they tended to eat, there are tribes out there that tended to eat a primarily vegetarian-based diet. So based on genetic evolution and also from where we come from, everyone's nutritional needs is a little different, and there is no optimal diet that is fit for everyone.
Where we come from, do you mean more in terms of like historically our ethnic kind of a background?
Oh, definitely. It's all based on genetics.
Okay, and I'd be interested to find out about
What you should be eating?
yeah, what I should be eating. I mean, how would I be typed in this metabolic type?
Okay, in metabolic typing, there's many different stages, but an initial stage is going through a questionnaire and seeing your own reactions of food. And most people, when they eat something, they do have reactions. 2 to 3 hours later of eating something, we're looking for reactions such as if your energy levels are good or bad, if you start getting sleepy, how's your mental clarity? Is it improving, or is you getting more blur? So there are definite signals that foods offer whenever you eat them.
I'm pretty awake today.
Yeah,
I
I
know
used
what
to
it
see
was
what
in
you were
my food,
eating.
my last meal. Yeah, I guess we never quite thought about it unless you actually do perhaps keep a record or a journal deliberately marking down what you had for lunch, breakfast, dinner.
Definitely.
I think that'll be a very good,
Yeah.
clue.
But I do know that rice and these things make me really sleepy in the afternoons.
Oh, pasta makes me sleepy.
Yeah, in the
And
afternoons.
those are the metabolic clues that you need to listen into, because every single meal you need to actually have more energy than you had before. You have to have better mental clarity. You have to have improved emotional stability. So there are definite clues.
Are there specific like classifications or types that the metabolic type kind of theory outlines?
Well, there are 3 different types. There is a protein type, there is a carbohydrate-based type, and there's a mixed type. But then within those types, there's a variation between the two. So like Stanley said, that there is a period where each individual needs to really just hone in on their own signals and start listening to their body and start recording their sort of symptoms that they get after certain foods.
Right, and I definitely have to start. I hope this test is available to people like us who don't have scoliosis. So I would definitely like to find out about
definitely.
it. Right, and looking at Singaporeans, I mean, we are definitely a food nation, food paradise, and a food nation sort of a thing. Now, how can Singaporeans start eating healthier based on a more traditional diet generally?
I think if most people just understand that they start focusing more on fresh food.
Yeah.
When you go to a supermarket and you go around to the perimeter, that's where most of the meats, vegetables and dairy aisle is.
All right.
Okay, that's the part where you just enter and you find all the fresh foods and not in the canned and the frozen food sections.
So go to the first section that hits you in your face and then get out at the cashier.
Yeah, you have to avoid the rest.
Yes, stay away from the biscuits and cookies and
ice cream.
chips. Yes.
That's where I'm usually hovering.
All right, Pam, you know where not to go now.
Right, and while you're in the living room, of course, we are talking about non-surgical treatments and natural ways treatments of scoliosis. And we are chatting with chiropractor as well as nutritionist Dr. Kevin Lau. And he practices at Orchard Clinic. And also he is the author of the book Health in Your Hands, Your Plan for Natural Scoliosis Prevention and Treatment, which is out in the major bookstores. And I will be telling you a little bit more about that, as well as where you can find more information in terms of websites. Well, I mean, Dr. Lau, I mean, tell us so far, I mean, when you see your patients so far, and I would imagine that they would be patients with varying degrees of scoliosis. With this sort of treatment, would you say that even those with above 40 degrees, they do not have to go through any surgical procedures whatsoever?
Okay, I think it really depends on how far the scoliosis has gone. Certainly at any stage of scoliosis, you can improve your diet, you can add exercises, and you can improve your general quality of life. There is unfortunately a period where there is too much degeneration for something that's more of a natural approach, and that's when you need to go and see a surgeon or something. I've seen curves that are in their 20s, but I've also seen curves that are in their 80s. So it really depends on the health of the spine.
Can this develop much later in life, let's say past the 10 to 15 age group, and develop, say, in adulthood?
Oh, definitely. And most scoliosis do progress as they get older. A lot of older people over the age of 40 are developing scoliosis that is due to degeneration of the spine. So these lumbar scoliosis, which are due to primarily just a sedentary lifestyle, sitting for long hours in the office, working on computers and whatnot.
You know, it suddenly dawned on me that we didn't quite establish whether or not scoliosis is a degenerative condition, just like arthritis is. Is scoliosis one?
Oh, definitely. In my mind, in my eyes, I see scoliosis as just an excessive aging of the spine, as well as a deformity.
Right, which can happen right from young, primary school.
Yes.
Yeah.
We're not looking at really you only having scoliosis when you're in your 50s or 60s and upwards.
Yeah, that's right. And what would be the worst case scenario? Let's say if it gets really serious. I mean, it wouldn't be life-threatening, would it?
It can be life-threatening, especially when the curvature starts putting impact in through the organs and start compressing things, or there might be difficulty in terms of breathing and heart function.
Yeah, that's right. And as always, I think you mentioned earlier about exercise. I mean, exercise is something I guess all of us cannot escape from.
Yes, Pam, including you.
I know. I've been saying it for 3 years. Now, why is exercise important for a healthy spine?
Okay. Well, I mean, most people don't realize that your spine thrives on movement. Most days, and most people these days that do suffer from back pain or back issues, it's largely due to the fact that they're sitting down for too long and they're immobile. Your spine consists of bones as well as discs. These discs actually contain a lot of fluid, or a lot of water. Now, most of these waters only go in and out of those discs just through movement. So in a day when you're not moving, water just continually pours out, and that's why they start to dehydrate and lead to other issues like degeneration.
Right, so it's good to keep the body moving quite a bit. It's called what, lubricating, I suppose?
Yeah, definitely.
Yeah.
And in your book as well, I mean, you have outlined a couple of exercises, that patients could do to self-help.
Yes.
Now, tell us a little bit about these exercises. Take us through a couple of them.
Okay. I mean, there's pretty much 4 different parts of the exercise program. There's a stretching component, which helps to fix any sort of tightnesses that people have in ligaments. There's a postural retraining component, which helps people improve how they hold themselves when they're sitting or standing or doing their daily duties. There's also a strengthening component, which helps to work on imbalances that develop over periods of time. And there's a core stability component, which helps to strengthen and support the spine.
And would all these exercises, though, be suitable for people of all ages?
Most of the exercises are suitable for most people of all ages and most scoliosis conditions.
Okay, that's pretty safe then. And if you look at and I'm just flipping through the book, and there are a lot of visual guides as well of how you can do these exercises, including using some of, these, what do you call these balls? Swiss balls?
Yes.
Swiss balls.
Yeah, those are big bouncy ones.
Yeah.
Not fish balls, it's Swiss balls.
Swiss balls.
Just in case our listeners are still stuck with the fish ball comment earlier by Pamela. And a lot of them actually can be done without much, equipment and what have you as well. You could actually just get a small little exercise ball like that and use it.
Yeah, and it is suitable for all age groups, so that is good news. It's not just for the young or the really fit.
Would there be certain sports that you would encourage, say swimming, good for the back and all?
Oh, definitely. I think when it comes to spinal issues, low impact tends to be the most important sort of exercises to focus on. So high impact sort of exercises tend to be those that where you raise both feet off the ground, so running or jogging or tennis or those sort of exercises. Swimming tends to be very low impact, cross training, walking. Those are excellent for the spine.
Okay, well, looks like I've got to cut down on my tennis then, and you better take up a little bit more exercise.
I know. That's right. And well, these are definitely self-help tips that we are talking about. Very practical, very self-help, and also they can be, you know, for everybody, not just those who are fit. And they can be found in the book called Health in Your Hands, Your Plan for Natural Scoliosis Prevention and Treatment. And the author of that book is Dr. Kevin Lau, who is our guest in the living room today. And he's a chiropractor as well as a nutritionist practicing at Orchard Clinic. And well, you can find out more from these websites. In fact, we have two websites that you can find out from.
And the website addresses are, take this down, get pen and paper ready, www.scoliosis.com.sg, spelled SCOLIOSIS.com.sg. Another website to visit that by the Orchard Clinic would be www.spinal.com.sg.
Yeah, that's right. And we've been chatting this past hour and a half with Dr. Kevin Lau, who's been shedding some light for us on this whole non-surgical treatment of scoliosis. Thank you so much, Dr. Lau, for coming in and sharing with us today.
Thank you for having me.
Thank you.